Um, all right. So I really, it was such a kind introduction that you gave me. I really can't build on that. But just to remind folks that as I go through this presentation and I talk about community engaged research, that I do bring a bit of a unique perspective in the sense that I both worked at a nonprofit organization and led research there. And now I find myself in academia and I conduct research from within an academic position. So I do have a pretty unique perspective, and it has really, really just enriched my research. So in terms of what we'll be discussing today, I'll start with just an overview of community engaged research. Some of you may be familiar, but just in case, want to make sure we're all on the same page, and why it's important to conduct community engaged research. I'll provide some actual concrete steps for conducting community engaged research and use examples from my own work throughout, as well as just some tips and suggestions that I have learned, sometimes the hard way, but I think are really important for us all to know. And then, of course, I'll give you all plenty of time to ask me some questions. All right, so starting with some basics. So community engaged research is a continuum. I would say that community-based participatory research, which is on the right side of this continuum, is probably the type of community engaged research that folks are most familiar with, but it's not the only type of community engaged research. Looking at this continuum again, you can see that on the left side, there's actually no community involvement, which would technically not be community engaged, and I would not advise it. And as you move farther down towards the right of the continuum, you have increasing levels of community engagement. All the way on the very right side, you have community-driven or community-led, which actually has minimal engagement from academic researchers. So I always suggest for folks, every research project is different, but if you want to be community engaged, getting as far right to the continuum as possible is best, because you have increasing levels of community, not only community involvement, but community ownership. And we're going to talk a little bit more about that. So the other thing to remember in this continuum is all of these factors that kind of inform community engaged research. So when you're working with people in the community, people with lived experience, you have to think about power and control is really important, right? A lot of times communities we work with have been marginalized, some have been mistreated by researchers. And so it's really, really important that they have the degree of power and ownership and control over the research as they desire, right? You need to think about things like who owns the data, who makes the decisions. You need to think about the history of the community you're working with. What levels of trust exist between communities and researchers, if at all? And relationship building is a really, really big part of doing this work. All of this I'll talk more about. So there are a lot of reasons why community engaged research is really important and why I use it in my own work. But at the center of it, it prioritizes the needs of individuals and communities facing health inequities. And of course, all health equity researchers are driven to address those inequities that have really pervaded the health of a lot of different communities. So there are definitely some differences between what I call traditional research and community engaged research. And when I think about traditional research, I think about research that's conducted with more of like a positivist lens, often more quantitative, things like that. So unfortunately, a lot of researchers are still in that space. But the more that we can do to, teach the research community how to conduct community engaged research, the better. So I already talked a little bit about the relationship building. In a traditional research approach, sometimes researchers just look at participants as subjects or patients or people who are there as participants in their research. Whereas community engaged research, if done correctly, you actually look at conducting real, true, equitable partnerships with your community as co-investigators or even multiple principal investigators or co-directors. Again, going throughout this table, which I won't read line for line, it's really about putting the community needs at the center of the research you're conducting. Also, in light of this series, which is on knowledge translation, I also want to highlight the importance of community engaged research in a kind of addressing that gap between research and practice and speeding up the knowledge translation process, because it puts community need and community ownership at the center of what you're doing and increases likelihood of implementation success. A little bit more about kind of the connection between community engaged research and knowledge translation. So I really like this figure that I took from the Grindle and colleagues here cited at the bottom. So thinking about the connection between community engaged research and knowledge translation. So in this article, they talk about what they refer to as co-approaches. So co-design, co-production. All of these approaches, although there are some differences, some nuance, really they all share the common goal of putting the needs of knowledge users, or in this sense, community members, at the center. It's the common denominator among these co-approaches and community engaged research. And so again, for those of you who are really focused on knowledge translation, using these community engaged approaches or these co-approaches increases your chance of success ultimately. And of course, the common goal that we all want when we're in health equity research is in improving health outcomes for the communities that we're working with. All right. So now that we have that primer behind us, I'm going to provide some more concrete steps about what this might look like in practice, knowing that, of course, there's no one way to do community engaged research. Oh, that went too fast. Okay, so first of all, when we're talking about community engaged research, who's the community? That's really important. You have to kind of figure that out at the beginning. So who needs to be at the table, right? It can be, you can define community as a shared neighborhood or specific, for instance, I live in Alabama, in Birmingham. It could be Jefferson County. It could be a group of people with a shared identity, such as people who use opioids. It could be a cross-section of, geographic place and shared identity. It can be anything, but it's really important that when you're thinking about who the community is, that you're being as thoughtful and inclusive as possible about who might need to be at the table when you're in the research cycle, right? So one way that I like to make sure I'm thinking about everybody who might be involved is to use a technique in human-centered design, which is called stakeholder mapping. I'm going to give you a messy, although realistic example from my own work about what this might look like. Okay, so I believe that Rob, in an intro, mentioned that I have an R01 and I'm interested in developing a harm reduction intervention for people with HIV who use drugs. So one of the very first things that we thought about in this work is who needs to be at the table when we are when we're designing this intervention, right? So we use stakeholder mapping. Okay, so again, I told you it was going to look messy. Don't worry too much about the specifics of what the slide looks like or try to zoom in and read the sticky notes. You can try if you want. Again, I know it's a little bit messy, but this is realistically what it looked like. Again, we drew from a technique that's used in human-centered design, which is similar to the co-approaches that I mentioned earlier. There are a lot of different approaches with similar, though slightly nuanced differences and different terms about which all really accomplish the same thing, putting knowledge users or community members at the center of the process. So what happened was we had a group of people literally sit down. We had researchers, people with lived experience using drugs, people with HIV, providers. We had a whole group of people that we thought might be some of the key stakeholders involved in this intervention, but we didn't just want to stop there. We wanted to kind of bring our minds together and really think about who might need to actually be involved, and was there anybody that we were missing. So everybody, it was just a free brainstorming event. Everybody could write down on a sticky note who they thought might potentially be involved in designing the intervention. And then we used another human-centered design technique called affinity clustering to group similar themes together. So at the end of the day, we came up with some groups that, and some of them we thought might be negative, including the IRB. If you zoom in really far, you can see that someone drew a sad face on that sticky note, but again, thinking of everyone who might be involved. So I just encourage you all, again, if you're really starting from scratch and designing an intervention with community, that you use a process like this or something similar to just make sure you're really thinking about who should be involved. So moving on to steps of conducting community engaged research. Again, this isn't necessarily linear. The whole process itself can be very iterative, but I'm just highlighting some key steps. So defining the partnership is another aspect of this that's really important. Thinking about roles, responsibilities, and who owns the data. That can be a really, really big one, because for myself, for example, I've worked with a lot of community organizations who have, amazing data sets. They've conducted years of HIV and SDI tests, and you have really rich data there. Other examples as well, but at the end of the day, it's technically their data, right? And so thinking about all of those equity indicators and developing rapport and all of those things. Be really careful when you're approaching a community organization or any organization who has data that might be useful for your study. Make sure that you're being really thoughtful about the ask. You also need to define the problem, the research problem. So there are a lot of different ways that you can do this. And again, it really goes back to what type of community engaged research, where you fall on that community engaged continuum. Is it community led? Is it researcher led? Is it CBPR? But again, is the problem defined by the community themselves? Is it combined by data you've collected, data that exists in their organization? It can come from a lot of different places. And of course, I always like to highlight that while there's always a problem that we address in research, there are also always strengths and resiliencies that exist within a community, and you want to highlight those as well. Okay. I also want to highlight the importance of terminology here, because this is one of these tips I've learned from my own work. So again, a lot of my research focuses on harm reduction, and that's a word that is, I have my own definition, which is a pretty common one, which is basically, preventing harm associated with substance use that doesn't necessarily involve abstinence-based approaches. But not all community organizations or community members that you engage with are familiar with that term. And for some, it may not carry any particular importance to them. So I'll give you an example. I had a discussion with a community organization a little while back, and I was really interested in working with them because it's in a community where there's a really high overdose rate. And so I went in there and I was like, I'd really like to talk to you about harm reduction. Before we get into it, I just want to make sure we're all using the same definition. So what does harm reduction mean to you? And no one spoke about substance use. So evidently, right, this wasn't a term that was particularly meaningful for them. what they talked about, what they were actually more concerned about was gun violence in the community. And so one person said, you know, when I think of harm reduction, I think about what can we do to prevent the gun related violence that we see in our community. So I just highlight this to make sure that you never make assumptions about what terminology your community uses. It may not be the same as yours. And then finally, of course, you need to design and implement the study, right? There is no one framework or no one set of methods that community engaged research uses. Again, it's a continuum. It's a framework for conducting research, right? Which informs your research, but it is not in and of itself a method. And so in order to conduct it, you need to actually have a set of methods that you're using. Those co-methods like co-design, co-production, that's a common method that's used in community engaged research. Of course, you can use qualitative, quantitative, or mixed methods. It's very flexible. Consider involving community members in the data collection process themselves and even analysis. I've had success teaching community members how to code qualitative data. And I find it to be incredibly meaningful because it's data that, you know, came from their community and they have their own lens when they're looking at the data. So definitely try to include the community to the extent that they're interested in being included. And of course, think about sustainability and dissemination from the beginning. This is really, 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 really important, which is why I bolded it and put a star next to it, because in the years that I've been doing this, there are far more community members, community organizations than I'd like that have told me that they are unwilling to conduct research. They don't care what it is. They don't care who it is. They've been burned and they absolutely do not trust the process anymore because they've been abandoned. They had a cool project, they had something going with a researcher and it was really successful. And then the funding ended, the project ended, the researchers went away and they were kind of left in the lurch. Unfortunately, this happens a lot. So really, I know that funding can be uncertain. It certainly is in my country right now, but you have to at least think about it and talk about it and impart to the community that you are thinking about it and it is important that you keep it going if it's something that is found to be successful. I'm now going to provide an example from a study I'm working on right now, which is, funded through the U.S. National Institutes of Health and my university's Center for AIDS Research. Ooh, it went so too fast again. Apologize. Okay, now we're back. All right, so to provide just a quick overview of what this study looks like. So the objective, again, I told you I'm interested in harm reduction. So the objective was to develop an intervention for people engaging in sex work that uses a community engaged approach, of course, and that addresses their sexual health and substance use. So using harm reduction in a very broad sense here, looking at both sexual and substance use related health. Kind of the impetus for this work was data that was collected by one of our community partners, which is they're an HIV organization and they provide HIV and STI testing. And they had amazing records from 14 years showing STI, HIV, substance use rates among their clients. They also ask everybody who comes and gets tested if they have engaged in sex work. And so we were able to actually look at associations between having reported sex work and these HIV, HCV, STI, substance use, all of that. Showed that there were much higher rates of all of STIs and HCV and substance use among clients reporting sex work. So we thought, well, this definitely looks like there's a need to provide services for this population. We set up what we call a health equity research assembly. So not not a CAB, not a community advisory board, but a group of people with either current or previous history in sex work to discuss what we saw in the data and to see if we could go about developing a program that would meet the needs of this community. So what we did was use a co-design workshop. So again, this is co-design, so it can be very community engaged if you're putting community members at the center. We had an in-person workshop with our Health Equity Research Assembly. So again, 6 people with lived experience as sex workers. And again, a little bit more about co-design. It's very much appropriate for use in community engaged research because of all these things that are at the core of community engaged research: joint ownership, participatory, all those things. And again, can help bridge the knowledge to practice gap. So the process of this is really broken down into 4 main steps. So discover, and this was done through qualitative interviews, which I'll talk about a little bit more. Defining the program or the problem, developing the solution, and then testing the prototype. It's very much a cycle and it's iterative because it's not just A to Z. You may test the prototype, find that it doesn't quite work. You need to go back to the drawing board, collect more data. So this can be very iterative. So we had some really, really rich interviews with 14 people who either, again, were currently engaging in sex work or had a history of doing so. And through these interviews, we found that the types of sex worker experiences were a lot more varied than we even knew going into the study. And so we ended up creating the research team and the HERA what we call typologies. So there are different buckets of sex work. Some are what we call adult content creators. So very much in the OnlyFans space or the adult film space. And each typology has different needs within them. So some have a lower perceived risk of HIV and STIs. Some have higher perceived risk. Some have additional needs, not just their sexual health and substance use. For instance, sex or survival sex workers on the right-hand side of this also have some concerns related to safety and some more immediate financial needs. So again, this was the result of our qualitative interviews, and all of these terms were those that were in line with not only the interviews but the experiences of the HERA. So we took those results and went into this workshop, kind of went over all of that again to make sure that everybody was on the same page, still felt comfortable with these definitions. It's like, okay, what next, right? So thinking about, we know that we want to address the needs of sex workers and we see that they're experiencing some health disparities, but what should be next? So we started by defining the problem, right? That's one of the key steps in co-design. So we asked them, again, you're going to see more sticky notes. I'm very much a fan of in-person, hands-on activities with community members because it's a very accessible. You don't have to worry about technology barriers. Everybody likes writing on pieces of paper and being creative. It really stimulates convergent thinking. So you're trying to think outside of the box. These activities may look simple, but again, they're really, really they're excellent for stimulating brainstorming and making sure that everybody has a chance to kind of share their own thoughts, right? So we posed the question, what should this intervention accomplish? Again, everybody had sticky notes. They could write what they wanted to, again, using affinity clustering. So sticky notes that are closer together have a shared theme. So the number one thing that they the sticky note that had the highest frequency, I guess you could say, is a desire to increase knowledge of and access to HIV prevention and safety services, which of course makes sense. But they had other ideas too, right? Reducing stigma, reducing violence, increasing empowerment and sense of community among sex workers. And I do want to say here too that while it would be challenging for one intervention to satisfy every single one of these desires, that nothing is ever lost in research, right? And so you can use this data to inform other programs, other interventions. Nothing ever goes to waste. So I encouraged everybody who was a part of this workshop to just brainstorm as much as you wanted, ask for whatever you wanted. At some point, we will be able to develop an intervention that addresses it. So I just wanted to throw that out there. Again, we asked them, what would success look like? So let's say you have the intervention of your dreams. How do you know that it worked? How do you know it's successful? Number one thing was decrease in STIs and STDs. They said that's really at the core of this. But of course, there are other aspects too. Improved patient-provider relationship, safer drug use, all of those things. Uh-oh, sometimes it goes so fast. Okay, now we're back. Okay, so we went through that brainstorming activity. So we had these sticky notes, we have the qualitative data. Like, well, what should we do with this? And so the idea is to actually create somewhat of a decision matrix for providers that integrates these sex worker typologies, because not each type of sex worker has the exact same needs. So that was the idea that folks really liked. Also talked about there should be both in-person and online components, right? Like, physical location is really important for delivering the services, but since a lot of sex workers find clients online, they thought it was important to have an online component. So a place to kind of share information about where is safe to go, where is a place that is sex worker friendly. So we have all of this data, and that's kind of where we are right now. We have another workshop next week, and we're going to continue to work on this and refine the prototype, and just really excited to see where it goes next. Okay. So I just want to share a few more kind of tips from the field, tips from my own experience, which experience has taught me they're all really important considerations for conducting community engaged research. So first of all, don't be a helicopter researcher. I know that we're all busy. We all have tight deadlines. And sometimes there's this funding announcement that comes out, and you need to submit an LOI, and you need all these things, but it's just not, it's not usually super, it's not very equitable or fair to go to a community organization you've never worked with and say, hey, could you write me a letter of support? I know we just met. Fortunately, I've seen this happen a lot, but again, that's not the way to do community engaged research. So relationship building does take time, and it's just a part of it. It's a really necessary part of this process. So rather than going to community first and saying, let's work on this research project, get to know them, right? Say, like, could you get some coffee with me? Can I help you, right? You may need something from them, which is a letter of support or whatever it may be. But you also have skills that could be really useful. Sometimes it's something like volunteering. Something that I've found is really, really helpful and uses my own set of skills is to assist with grant writing. Not all community organizations, not all nonprofits, rather, have staff that are trained in writing grants, and it's a really important skill to have now more than ever. And so if you're someone with expertise in grant writing, that's a really, really great skill to share. And so again, it's all about that relationship building and not just immediately asking, what can they do for you? I mentioned community advisory boards a little bit earlier. There is a history of them in the US. They were established as a necessity for HIV related grants funded through the NIH. So you see them a lot in HIV research, but they've definitely grown in popularity. I think that there can be a lot of good done with community advisory boards. The problem is that, especially for funding mechanisms that require formation of a CAB, which I see a lot here, um, that means that in some cases, right, you're forming it kind of last minute. You may not really be approaching the community in a very equitable way. And so, worse than anything, in my opinion, is having a CAB that is tokenistic. And so, again, CABs can be great and they can be a great way to integrate community expertise and to provide definitely you want a community leader in your CAB, but they can be done the wrong way. So just throwing that out there. Okay. Additional considerations from my own experience. So it can be hard, at least at my university, for folks to find parking. It's nearly impossible if you don't have a parking pass and you're a faculty member. So be thoughtful about things like accessibility. Be thoughtful about things like meeting times. Sometimes, a 2 p.m. meeting isn't going to work for somebody because they're working their own job. So you really do have to be open to meeting times that are after hours or on the weekends. Really think about your terminology. I spoke about that already, but it's also important in the sense of don't use jargon. Don't create this space where you're using words that they're not familiar with, and it creates this power imbalance and makes them feel uncomfortable. And also give yourself plenty of time to work through data sharing and reliance agreements and all of that. At least at my university and my institutional review board, it can take a lot of time to kind of get that set up. And so just work that into your time frame. Consider a shared leadership structure. So definitely, engage community members in things like data analysis, like I already spoke about, co-investigators, but even think about them as MPIs or co-Is, right? In my own experience, a lot of time, increasingly at least, or at least until recently, funders and grant reviewers really appreciate this structure and community engaged research to show that they're actually part of the leadership team, again, as they should be. And so here's just an example from one of my grants that I actually brought to UAB from my previous organization. So when this grant started, my MPI was at UAB. I was at the community organization. We had leadership from both UAB and the community organization, an advisory committee of folks from nonprofit and UAB. And then we had faculty partners and community partners. So I also find that when you're thinking about the structure of your grant, thinking about where community members have a role, write up a leadership chart and see what it looks like. Like, is there an opportunity for someone from the community to have more of a leadership role? Again, I think the answer is if it's something that they want, that you should really try to make that happen if you're conducting community engaged research, right? So, in conclusion, big fan of community engaged research. I think everyone should be when you're in the health equity space. It brings community members and researchers together in an equitable partnership rather than one where researchers kind of use community members. We really can't hope to solve health problems without community expertise. And again, community engaged research is also really important for knowledge translation. So I'm going to pause here. Of course, I'm happy to answer any questions, and I tried to leave us as much time as possible for questions. I'm going to stop share. All right, now I can see you all straight ahead.
Amazing, Emma. Thank you so much. I'm just going to
Thank you.
my video and come back here for a second. if I can. There we go. Sorry. That was incredible. Really, really appreciate it. The context and landscape you laid out, I was like rapidly taking notes on some of those citations you were sharing because it's very valuable to me personally.
Great,
The
great,
example really helped bring that to life, though, and I think that was
good.
super, super valuable to understand those different spaces you might be on a spectrum. And when you're giving your tips, I had so many moments of like, oh my gosh, cheering that on is a similar challenge I faced. But then I also had like light bulbs going off about the way you were
Mm,
interpreting a challenge that I think I faced before, but interpreted it a little differently. And so like that was
okay,
so useful to hear the way you're approaching these issues
great.
in your work. So I'm just very appreciative. I do
Mhm.
now want to open it up for questions, but I think I'm going to abuse my privilege as moderator of this meeting and ask one myself first.
Great.
And colleagues, if you want to drop your question in the chat or raise your hand, we'll have numbers associated with your hand so we can get to you that way too. But as you're talking about the continuum of engagement,
Mhm. Yeah.
I just wondered, like in your experience at UAB, obviously across the country too, where do you think researchers currently fall in general? And are there barriers to moving us further towards that right-hand side that you'd see are
Mm,
systemic or kind of the major challenges we're facing? I'd
yeah.
just love to know your experience with that.
Yeah. I love that. So I would say that that community consult part of the continuum is where I see most researchers fall. So they do ask, what do you all think about this idea? Would you be interested in writing a letter of support? Maybe could I use some of your data? But they're not really integrating community expertise into the project. So it's more of like
Mhm.
ear hustling. Um, so, in terms of barriers, I think part of it is just knowledge, right? A lot of us, or at least I'll speak for myself, I wasn't taught how to do this in school. I really learned on the job working at a community organization. So, again, I do bring a perspective that is unique. The other barrier that has really been the funding landscape. So,
Mm.
RFAs or NOFOs or whatever you want to call them often have a really quick turnaround. Increasingly, again, increasingly, except for right now, which you all know I'm in the US, but before this, I was seeing at increasing levels of funders like PCORI um, or NIH more so say, hey, we want to see community involvement. Let's put together a CAB, blah, blah, blah. So funders didn't really have a good sense of what it means to do community engaged research and would write the funding guidelines in a way that kind of put researchers in a position of, unless they already have a great established relationship, they might have to like swoop in and ask for a letter of support. So those have been really the primary barriers that I've seen. But the more that funders can get on board and actually support community engaged research and fund it, I think that'll help a lot.
Thanks, Emma. And you're hitting close to home. Working most of my time at a research funder, I couldn't agree with you more, though. There's a lot we need to do to advance this field and be partners in it ourselves.
Yeah.
Um, so I see we have a hand up and some questions in the chat, but maybe I'll go to Pamela Claassen first to ask you a question.
Thanks, Emma. Can you hear me?
Yes. Hi.
Great. Yeah, so thank you so much for that great presentation. I love the steps that you laid out, and I found them really helpful. I'm in a sort of a similar process right now, not at all similarly or similar topic-wise, but
Okay.
the step of discover. So in your case, the results of your qualitative interviews.
Mm-hmm.
Can you speak a little bit to engaging your community partners in something like a qualitative analysis? How
Mm-hmm.
many would you engage in that process? Because we know how heavy that can be. And then for those who you don't actually have doing the analysis with you, How do you
Mhm.
bring them into that step two, well informed enough about your results to sort of define the problem based on that
Yeah.
that first step?
Great question. So, in terms of engaging community members for that discover phase, so qualitative interviews, um, a lot of people were actually very interested and eager in sharing their experience with us. So, recruitment wasn't very challenging. So, we started with our HERA. First of all, we gave them the opportunity. Would you like to interview? And then we said, we'd love to talk to some folks in your network, your friends, your colleagues. Would you be okay asking them if they would be interested in your interviewing? So we really leaned on them and the people they knew and the people that who they knew who felt comfortable with them. Again, thinking about our topic, which was sex work. And it a lot of again, like the overarching um, response we got was thank you so much for asking. So while data collection can be a time burden, if you're in a topic where you're working with a really underserved population, um, sometimes they might just really be happy to spend that time sharing their experiences with you. Um, and then in terms of the data analysis stage, right? So if community members aren't interested in looking at data with you, you can still do things like um, cover like the sex worker typology slide. Let's say that they weren't already familiar with the interviews. That might be their introduction to the results. But we'd say, what do you think about that? What does that resonate with you? We would probably refine it with them, things like that. So there are always opportunities to bring in community members. You just have to be thoughtful and don't get caught up in feeling there's only one way to do it. This is really a space where I encourage creativity.
Thanks so much.
Thank you.
Thanks, Emma. And I think there's a great follow-up to that already in the chat where Shannon McDonald was asking about the sustainability stage. And so you talked about not abandoning the community, but she asked if you could give some
Absolutely.
examples of that too.
Yeah, so that is the hardest part of this work, and it's only gotten harder. So I can tell you about some things that I've done. So the biggest part, right, is not even, I mean, sustainability of the program is important, but the number one thing is don't just walk away. So continue to remain engaged with that community. Maybe you have some sort of a collaborative or advisory board with them and you maintain that and you continue to look for funding mechanisms, right? Um, you can also start by well, you should always start, right? Kind of thinking about what your other funders could be. So maybe this is a funding mechanism that lasts 2 years and there's no ability to reapply. We start thinking about what some other possible funding bodies could be with them, right? You can just say, hey, I'll continue to work with you. I'll continue to help you look for grants. I'll help you write grants. The hard part about sustainability is there's no guarantee with funding and you can't unfortunately make that guarantee. But again, what you can do and what I think goes a long way because community members understand the landscape generally if you explain it to them that I will stay with you and we will continue to look for alternative sources of funding. So I know that's not unfortunately again like you can't I wish there was a better answer, but it is the true answer and it's just stay with them.
Yeah, I appreciate that actually. It's like just bringing it to the surface and being transparent and discussing it.
Always be
Yeah.
transparent.
Yeah.
Yeah.
No, that's very helpful. We have another question in the chat from Andrea Chittle from the Public Health Agency of Canada. And she is asking, she's thanking you for a great presentation and asking again about your real example. And so you had initial discussions with the community where they highlighted a different priority, gun violence, than the one that you were hoping to bring forward, overdose deaths.
Yeah.
Did you have sufficient flexibility to pivot your agenda to align with what they were suggesting was the priority?
Yeah, so great question. So this particular conversation, I didn't come in with an agenda. I thought that maybe harm reduction might be of interest, and that's why I was there. It turned out it was a little bit, but not a lot. So ultimately, what they were interested in is again addressing gun violence. So what we do have at my School of Nursing, I don't know, I don't want to assume that you all know what this is one way or the other, but we have something called Stop the Bleed. So it's really nurses teaching community members how to, unfortunately, if you're in a situation where you've been shot, how you literally stop the bleed. And so that was something that they were very, very interested in. But they were like, well, you're right. Like, definitely harm reduction is important too. So let's combine that with Narcan. So that's kind of how we address that particular situation. But I do love that example just because having those initial conversations, you may think you have an idea of what may be important, may be of interest, but it may not be, or it may be of interest, but it isn't the focus.
Great. I'm going to go. We had a question submitted in advance for this session, and I'm going to go to that one now. And colleagues, raise your hand or type them in the chat if you have any others you'd like to have this opportunity to discuss with Dr. K. But in advance, we heard from a colleague who asks, how would we plan stakeholder identification and engagement for eventual strategy co-creation and even community-led monitoring of implementation in a community with socially and culturally diverse populations?
Okay. So definitely, I think that stakeholder um, uh, um, kind of activity that I showed you all earlier is a really good place to start, right? So identifying potential stakeholders who should be at the table, because you as the researcher might not know, or you might not know everybody who should be at the table. So that's a good place to start. And then it really just comes down to, so the question asks about community-led monitoring. So ideally, right, you should be working hand in hand with a community board or organization, whatever the group is, and they're co-leading the project with you in every sense. So I hope I answered that question sufficiently for that individual. I just saw something else pop into the chat as well.
Yes, about reimbursement for time.
1,000%. No question, you have to. Okay. Thankfully, community members expect it, at least in my community. They know that their time is valuable as it is. And yeah, everything is, all of the meetings, their time, it's definitely compensated.
Thanks, Emma. Yeah. And there's another one in the chat, which again, to the kind of the cycle or life cycle of doing this type of work, and right at the very beginning. So about engagement and recruitment of individuals from a community. If you have any tips? It seems like for our colleague Hala Abbas, it's sometimes difficult to recruit community members to a study. And so if in a particular situation it had been difficult, are there any strategies you could recommend to getting past any barriers?
So recruitment is always hard. For me, and my colleagues, we talk about this all the time. Recruitment is the hardest part of research. But the only thing that I found that really helps, and which should exist anyway, is community buy-in. So if the community is already excited about your project, if they know that you're recruiting for something that is also important to them, then word of mouth goes a really, really long way. And so that's part of recruitment, right? That's farther along on the research cycle. But if you've already established this rapport with a community and you've already identified that this research is important to them and they're aware of your study, then yeah, their excitement about it and their word of mouth is the best way to increase recruitment numbers. Even then, sometimes people are just burned out and the study is of interest, but you just don't have people just like, I don't feel like taking a survey. I don't feel like doing an interview, whatever it is. So it's not 100% foolproof, unfortunately, but it does really help.
Great, thanks. Then I have another question, Emma. that I wanted to ask you. We're running out of time, and I think it would be really, really helpful for us to hear about your journey from working in
Mhm.
a community organization to being in an academic position and how that's gone for you. Any reflections you'd like to share? I think a lot of people in this room might be in similar situations.
Yeah, thank you. I wouldn't change my journey for anything. It hasn't always been linear. Um, but it has been absolutely full of excellent lessons learned, and I think it's all made me a better researcher. So, yeah, I really did start my career in a nonprofit organization, which really shaped my the way that I engage as a researcher. So I've always been very, very sensitive to the things that I ask, the way that I ask it. Um, I've never even for a second had to question the fact that community members have expertise that I will never have. And that even just from a research standpoint, from a science standpoint, their contributions are invaluable. Um, in terms of moving from a community organization to a university setting, I've really not a lot about my day to day has changed. I've always done a lot of grant writing. I continue to do that. I continue to do the same research that I have always done in the way that I've always done it. So that really has not changed. And I think that's good, right? I wouldn't want to view my time at a community organization as like 180-degree difference from where I'm at now. I've just brought those skills in a different setting and I continue to do the same thing. So I firmly believe that no matter what type of institution you're at as a researcher, you can still do the same good work. Maybe the specific grants you go after are different. Maybe your colleagues are different, but really not a lot should be different. There's definitely no one right path to do community engaged research. You can do it anywhere. I
Do you
truly
find,
believe that.
do you find that the university is values those skills that you've brought to your role? Yeah,
Yes,
great,
they
great.
do.
Um, Great. Well, I am going to do the Canadian thing of keeping us on time for our session today and begin the wrap up by thanking you so much, Emma. That was really, really helpful, very insightful, and I think there's a lot of practical takeaway for many of us who are here. Um, Megan is going to drop evaluation into the chat, which we hope you'll all follow that link and help us get better at the KT seminar series. And I am going to announce that the next session is being held on May 22nd. And I'll actually be presenting with Dr. Ian Graham. And we were really hoping we could support Emma's important conversation and discussion today by presenting a little bit more on this topic of doing research with those who will use or benefit or hold knowledge. So really excited to continue what you've kicked off today, Emma. I appreciate it sincerely. Thank you, everyone, for coming in.
Thanks all.
Thank you, Dr. K, and thank you, Dr. McLean, for moderating, and thanks everyone for joining. And I look forward. I'll see you again in a few weeks, Dr. McLean and Dr. K. Please stay in touch with us. We'd love to.
Oh, I definitely will.
We'd like to work together again.
You've got me hooked.
Excellent. Okay. Take care.
All right. Bye.
Thanks,
Thanks
everyone.
so much, y'all.
Thank
Bye.
you.